still drinking the same milk you loved at 40. That single choice could be spiking your insulin, weakening your bones, and clogging the very arteries you want open. I'm Dr. Justin Keller. In the next few minutes, you'll learn the 4 milks seniors must avoid. One of them is marketed as heart-healthy, but actually raises fracture risk. The 4 milks that protect bones, stabilize blood sugar, and keep blood flowing where it matters. A timing trick that turns milk from a belly bloater into a sleep and circulation booster. One evening recipe you can start tonight for calmer joints and deeper rest. Stay until the end, because the first milk on the never list is the one most doctors still recommend, and fixing that mistake flips every other health switch. Type your city in the comments so we can see where smart dairy choices are spreading. Tap like and subscribe to Glowing Aid. Your click tells me to keep bringing clear, doctor-level solutions you can use the same day. Let's upgrade your glass. How milk affects the aging body after 60. Pour a glass of the wrong milk at 65, and it can silently raise your blood sugar, inflame your joints, and even weaken the bones you hoped it would protect. Here is what changes once you cross 60. First, lactase production plummets. That enzyme breaks down milk sugar, lactose. By retirement age, up to 70% of adults make only a fraction of the lactase they had at 30. Undigested lactose ferments in the colon, producing gas, bloating, and low-grade inflammation that seeps into the bloodstream. Chronically inflamed tissue stiffens arteries and dims sexual performance long before you feel stomach distress. Second, your insulin response sharpens. Aging muscle loses its ability to soak up glucose quickly, so anything that pushes sugar into the blood, like skim or flavored milk, spikes insulin higher and keeps it elevated longer. Every spike accelerates fat storage around the waist, the exact place abdominal fat pumps out estrogen and sabotages testosterone. A 2021 study in metabolism found men over 60 who drank 2 servings of low-fat milk daily had a 23% higher fasting insulin than those who chose full-fat or plant alternatives. Third, fat carries vitamins you now absorb less efficiently. Vitamins D, A, and K2 ride on milk fat. Remove the fat, as in skim, and you strip away the nutrient ferry. Seniors already absorb fewer fat-soluble vitamins because stomach acid is lower. Deficiency shows up as porous bones and slower immune response, the opposite of what milk advertising promises. Fourth, casein type matters. Conventional cow milk in North America contains mostly A1 beta-casein. In susceptible guts, A1 breaks into BCM7, a peptide tied to inflammation and arterial stiffness. A2 milk or goat's milk avoids that peptide and is processed more easily by aging digestion. New Zealand data shows seniors switching from A1 to A2 milk cut gut discomfort scores in half within 2 weeks and lowered CRP, an inflammation marker, by 16%. Fifth, hormone residues accumulate. Commercial dairies often rely on pregnant cows producing late gestation milk rich in estrogens. Older men and postmenopausal women have less room for hormonal noise. Excess dietary estrogen raises prostate growth risk in men and can worsen fluid retention or mood swings in women. Choosing hormone-free or non-dairy options trims that exposure. Finally, kidney filtration slows. High-phosphate additives in processed dairy pull calcium out of bone and push it through the kidneys, increasing stone risk. At 60+ GFR, the metric of kidney efficiency drops roughly 1% per year. Phosphate-loaded chocolate or strawberry milk strain an organ already working harder. So the milk that powered your childhood may drain your vitality now. But you do not need to abandon the comfort of a creamy splash. You need to pick the versions that match an aging metabolism. In the next segment, I'll expose the first of 4 milks hiding on grocery shelves that quietly sabotage your circulation and energy, and what to pour instead. Skim milk and processed dairy, the hidden dangers. The label screams, fat-free, as if it were a badge of honor. For seniors, skim milk is often marketed as the safest choice for the heart and waistline. The reality is almost the opposite. When dairies strip fat from whole milk, they remove the very vehicle that carries vitamins D, A, and K2 into your bloodstream. Without fat, those vitamins pass through unabsorbed. Bones depend on vitamin K2 to shuttle calcium into the matrix. Seniors who drink mostly skim milk frequently show lower bone density scores, even when total calcium intake is high. A Harvard study of men over 60 found those in the highest skim milk group had 38% greater hip fracture risk than peers who chose full-fat or fermented dairy. Then there is the insulin problem. Skim milk concentrates lactose sugars per ounce because the fat is gone. Your aging muscle cannot buffer glucose surges like it once did, so the pancreas overreacts. 1 cup of skim milk can drive insulin as high as a slice of white bread. High insulin pushes lipids into abdominal fat, the retirement ring that raises blood pressure and lowers testosterone. Multiple trials show fasting insulin drops when older adults replace skim milk with unsweetened almond or A2 whole milk. Processing adds new risks. To improve mouthfeel, many manufacturers blend powdered milk solids back into the liquid. That process oxidizes cholesterol, creating oxysterols that promote arterial plaque. Oxidized cholesterol is far more atherogenic than dietary saturated fat. In coronary autopsy studies, oxysterols embed in plaque cores that later rupture and cause heart attacks. Ultra-high temperature, UHT, pasteurization, common in shelf-stable skim cartons, denatures whey proteins into advanced glycation end products. Ages stiffen skin, but more importantly, artery walls. For seniors already fighting endothelial rigidity, each carton adds another microdose of rust to delicate vessels feeding the eyes, kidneys, and pelvic region. Taste often betrays the problem. Many older viewers admit they pour a sweetener into skim milk to make it tolerable. That tablespoon of sugar spikes insulin even higher. Add a bowl of cereal and you have a metabolic bomb disguised as a heart-healthy breakfast. So what is the better move? Choose full-fat A2 cow milk or goat milk if you tolerate dairy. The fat slows glucose entry, carries fat-soluble vitamins, and contains CLA, shown to reduce arterial plaque. If dairy upsets your gut, reach for unsweetened almond or oat milk fortified with calcium and vitamin D. Both offer creaminess without lactose, powdered solids, or oxidized cholesterol. Fermented options such as plain kefir or yogurt deliver probiotics that improve gut health and lower the inflammatory load skim milk leaves behind. Remember, fat is not your foe, processed absence of fat is. At 60 and beyond, your body needs nutrient density, stable blood sugar, and gentle digestion, none of which skim milk provides. In the following segment, we will uncover an even sweeter villain: flavored milks that pack more sugar than soda and silently erode brain clarity and vascular health. Flavored milks, sugar bombs masquerading as dairy. A single 8-ounce glass of store-bought chocolate milk carries up to 25 grams of added sugar, more than a glazed donut. For seniors already battling slower insulin response, that sugar surge is metabolic sabotage in a glass. Here is what happens. The first sip races through the stomach because liquid sugar needs little digestion. Blood glucose spikes within 15 minutes, and insulin shoots up to corral it. In men over 60, muscle cells respond sluggishly, so excess glucose is shunted into visceral fat. That fat wraps organs, secretes inflammatory cytokines, and produces aromatase, an enzyme that converts precious testosterone into estrogen. Over time, you trade masculine drive for belly fat and joint stiffness. High sugar also accelerates advanced glycation end products. Ages bind to collagen in arteries, making them stiff and brittle. Harvard researchers followed 1,200 adults for 10 years. Those with the highest habitual intake of sweetened milk had double the arterial stiffness and a 30% higher stroke risk compared with unsweetened dairy consumers. Chocolate milk piles on another threat: caffeine and theobromine from cocoa. These stimulants spike heart rate late in the day, raising nighttime blood pressure, the opposite of the vascular relaxation you should experience during sleep. Combine that with sugar and you create a roller coaster that fragments deep sleep, the very window when growth hormone repairs bones and vessels. Artificial flavors in strawberry and vanilla milks add propylene glycol and red dye 40. The FDA allows small amounts, but aging kidneys clear additives more slowly. Red dye is linked to hyperactivity in children. In older adults, it elevates histamine release, worsening arthritis and benign prostate swelling, both common complaints in my clinic. Then there is phosphate. Flavored milks often include dipotassium phosphate to keep cocoa particles suspended. Extra inorganic phosphate pulls calcium out of bone and crowds it into blood vessels, a pathway known as vascular calcification. Seniors battling osteoporosis cannot afford that exchange. A common argument is, but chocolate milk has protein and electrolytes. True, yet you can get 10 grams of protein and potassium from plain kefir or an unsweetened almond protein blend, without 20 grams of liquid sugar. If you crave flavor, upgrade strategically. DIY cocoa milk. Stir 1 teaspoon of unsweetened dark cocoa and a few drops of monk fruit sweetener into warm A2 or unsweetened almond milk. Net sugar, under 2 grams. Berry-infused milk. Blend half a cup of frozen raspberries with unsweetened oat milk. You gain fiber, polyphenols, and natural tartness that keeps glucose flat. Cinnamon turmeric latte. Heat goat milk. Add a pinch of cinnamon and turmeric for anti-inflammatory punch with 0 added sugar. Taste need not vanish when sugar does. It simply shifts from factory additives to real spices and fruit. The lesson is clear. Flavored milks promise nostalgia but deliver insulin spikes, arterial rust, and hormonal drift. At 60 and beyond, every gram of added sugar accelerates the very aging processes we fight. Choose unsweetened bases, spice them yourself, and let flavor serve health rather than erode it. Next, we tackle 2 culprits lurking at opposite ends of the dairy aisle: conventional A1 cow milk and non-dairy creamers, each packing hidden hazards that quietly clog arteries and dull libido. Conventional cow's milk and non-dairy creamers, silent saboteurs. Picture a glass of farm-fresh milk from decades ago. Grass-fed cow, no hormones, minimal processing. Now compare it to the average jug in a modern supermarket. Same white color, radically different chemistry. Mass-produced cow's milk in North America comes almost entirely from breeds that carry the A1 beta-casein gene. When this protein hits your gut, enzymes split off a fragment called BCM7. In sensitive adults, especially those over 60, BCM7 slips through a thinning intestinal wall and triggers systemic inflammation. European studies link high A1 intake to thicker arterial walls and slower cognitive speed in seniors. Switch to A2 milk or goat milk, and inflammatory markers like CRP drop within 2 weeks. Then there are the hormones. Late gestation cows produce milk naturally high in estrone and estradiol. Industrial dairies milk them continuously, concentrating those estrogens in every carton. Older men already face falling testosterone. Pouring extra estrogen into the mix accelerates belly fat gain and prostate enlargement. Women past menopause see fluid retention and breast tenderness spike for the same reason. Antibiotic residues add another layer. Even trace amounts disrupt gut bacteria diversity, reducing butyrate-producing strains that protect the colon and help regulate insulin. A disrupted microbiome translates to weaker immunity and higher blood sugar, 2 burdens aging bodies can't spare energy for. Many seniors try escaping dairy by switching to non-dairy creamers. Most are worse. Flip the label and you'll find hydrogenated soybean or palm oil, corn syrup solids, artificial flavors, and phosphates. Hydrogenated oils deliver trans fats proven to stiffen arteries and lower HDL, the good cholesterol that sweeps plaque away. Corn syrup solids spike insulin faster than table sugar. Phosphates added for whiteness and shelf life leach calcium out of bones and calcify soft tissue, including heart valves. Even zero-sugar creamers hide sucralose or acesulfame potassium. These sweeteners trick your brain into an insulin response without calories. Blood sugar plummets, hunger surges, and late-night snacking follows. Over months, that roller coaster stores more fat than the tablespoon of real cream you tried to avoid. So what goes in your coffee tomorrow? A2 whole milk from certified herds. Same calcium, fewer inflammatory peptides, natural fat to carry fat-soluble vitamins. Unsweetened almond, macadamia, or cashew milk with no gums or oils. They lighten coffee without raising insulin or clogging arteries. Coconut cream, 1 teaspoon. Rich in lauric acid, which can raise HDL and support brain energy, especially valuable if you battle afternoon fog. One of my 75-year-old patients replaced his daily flavored creamer with 2 tablespoons of A2 milk. In 6 weeks, his fasting triglycerides fell 30 points, morning stiffness vanished, and he dropped an inch off his waist. No other lifestyle tweaks. Remember, what you add to your mug 3 times a day matters more than any once-a-month supplement. Conventional cow's milk and synthetic creamers look harmless, but for an aging cardiovascular system, they are stealthy saboteurs. Choose cleaner, hormone-safe options and let your blood vessels relax instead of react. The right milks to choose: A2 goat, unsweetened almond, and oat. You do not need to abandon milk's comfort to protect your heart, joints, and libido. You just need the versions your aging body still recognizes as food, not chemistry experiments. A2 cow's milk is first. The cows are the same species, but selective breeding gives them the A2 beta-casein gene instead of A1. No BCM7 peptide, no inflammatory backlash. In a double-blind trial from Curtin University, adults who switched to A2 for 2 weeks reported 60% less bloating and showed lower CRP and blood work. Crucially for men, vascular stiffness scores improved, suggesting smoother blood flow where it matters. Flavor. Identical to the whole milk you grew up on, rich, creamy, perfect for coffee or cereal. Pick full fat. The fat slows glucose entry and ferries vitamins D and K2 straight to your bones. Next up, goat's milk. Its fat globules are 1/5 the size of cows, so they slip through digestion with less bile and pancreatic effort, ideal for seniors with reduced enzyme output. Goat milk has 10% more calcium and nearly double the medium-chain triglycerides that feed brain cells directly. A Greek study tracking elderly villagers found regular goat milk drinkers had 20% higher bone mineral density and sharper short-term memory scores. Taste is slightly earthy. If that's new for you, start with goat milk yogurt sweetened by a handful of berries. For those who feel best dairy-free, unsweetened almond milk is the lightest option. 4 primary benefits: 0 lactose, nearly 0 carbs, natural vitamin E for arterial elasticity, and a gentle alkalizing effect on the kidneys, important when glomerular filtration slows with age. Look for cartons with no carrageenan or added gums. The ingredient list should read almonds, water, salt, and maybe calcium carbonate. Pour it over oats or blend it with cocoa, and a pinch of monk fruit for a dessert that will not spike insulin. If you need something heartier for coffee foam, choose unsweetened oat milk. Oats contain beta-glucans, soluble fibers proven to lower LDL by binding bile acids. One Swedish trial gave seniors 2 cups of oat milk daily. LDL dropped 8 points in 4 weeks, and pulse wave velocity, a measure of arterial stiffness, improved 5%. Buy brands with under 3 grams of sugar per serving. Some add maltose syrup that mimics dairy sweetness but sabotages blood sugar. No single milk fits every moment, so rotate. Use A2 or goat for nutrient density earlier in the day when insulin sensitivity peaks. Almond or oat work best after dinner when lightweight hydration trumps calories. One more tip: shake plant milks vigorously. Calcium fortification settles on the carton floor, stealing bone support if you pour too gently. Swap out the milks we condemned and introduce these 4. And you turn every sip into microtherapy, feeding joints, easing blood vessels, and supporting hormones without the silent costs of modern dairy processing. Daily habits to make milk work for you, not against you. Milk can either support your aging body or quietly work against it. The key isn't just which milk you choose. It's how, when, and with what you consume it that determines whether it strengthens your bones, balances your hormones, and improves your blood flow, or inflames your gut, spikes insulin, and drains energy. Let's start with timing. Your body's insulin sensitivity is naturally higher in the morning and earlier in the day. That means you process carbs and sugars more efficiently during breakfast or lunch. So if you're adding oat or goat milk to your diet, try to consume it before 2 p.m., This helps prevent unnecessary insulin spikes that lead to afternoon fatigue or late-night sugar crashes. Seniors who shift their milk window earlier often report improved energy and better sleep. Now let's talk about pairing milk with other nutrients. One of the most common mistakes I see is older adults pouring oat milk over sugary cereals or using almond milk in artificially sweetened protein powders. This is like putting clean fuel into a dirty engine. The milk alone may be beneficial, but the pairing cancels the gain. Instead, combine the right milk with anti-inflammatory, fiber-rich, or protein-dense foods. Here are examples that work well for men and women over 60. Goat milk plus chia seeds plus blueberries. Rich in omega-3s, gut-friendly fat, and antioxidants that protect the brain. Unsweetened almond milk plus unflavored protein powder plus cinnamon. A blood sugar-friendly shake with zero insulin spike. Oat milk plus turmeric plus ginger. A warm evening drink that supports blood flow, joint health, and digestion. A2 whole milk plus steel-cut oats plus walnuts. Morning fuel that feeds muscle, supports testosterone, and sustains energy. If you're taking medications, especially for high blood pressure or diabetes, timing matters even more. Some medicines affect how your kidneys filter calcium or how your gut absorbs nutrients. Taking milk-rich meals within 2 hours of those medications can reduce their effect. Speak to your pharmacist or physician, but a simple rule: milk-based meals earlier, meds spaced apart. What about fasting windows? Many older adults benefit from light intermittent fasting, 12 to 14 hours between dinner and breakfast. During this time, insulin levels fall, fat burning rises, and blood sugar stabilizes. If you're drinking milk before bed or in the middle of your fasting window, even a small splash of oat milk can interrupt the benefits. If you follow a fasting window, choose unsweetened almond milk in tiny amounts or stick with herbal teas at night. Another overlooked factor: movement after meals. Milk digests better when your body moves. A short walk after a milk-based breakfast reduces post-meal glucose by up to 20%. In fact, a Japanese study found that seniors who walked just 10 minutes after consuming a dairy-rich breakfast lowered their systolic blood pressure and experienced improved circulation by the end of the week. Here's a simple daily routine to make milk work in your favor. Mornings: A2 or goat milk with steel-cut oats or a veggie scramble. Take your walk after breakfast, 10-15 minutes. Midday: almond milk smoothie with protein and fiber. Add a sprinkle of flax or turmeric for inflammation. Evening: oat milk turmeric latte or warm goat milk with cinnamon. No sugar, no snacks, no milk 2 hours before bed. And remember hydration. Milk is not water. Many older adults cut their water intake and replace it with milk, tea, or coffee. This leads to dehydration, poor circulation, and slower digestion. If you drink milk during the day, add 2 glasses of water per milk serving to stay balanced. With the right milk at the right time and the right pairings, you don't just avoid harm. You actively support brain clarity, joint strength, hormone balance, and circulation in ways pills can't match. In our final section, we'll wrap up with the biggest milk mistakes most seniors make, and how one small shift tonight can help you sleep better, digest better, and move better by morning. You now know the swap: skim, flavored, conventional A1 and chemical creamers out. A2, goat, unsweetened almond, and oat in, rotated, timed, and paired with real foods. Choose one new milk, one new timing habit, and track your morning energy, joint comfort, and waistline over the next 7 days. Then come back and share your results. Your story helps the next viewer take action. If this guide helped you, hit like and subscribe to Glowing Age. Your support keeps these practical, science-based lessons flowing so every senior can drink smarter, move easier, and age with quiet power.